Corona suspects and curfew breakers. Reopening America. Governors provide timelines for easing restrictions. Several have already done so, while many state leaders say it's just too early to make that call. Former New Jersey Governor Christie joins us. Testing for antibodies and their life-saving potential. An up-close look at a successful treatment. But can enough test kits make it to areas with the greatest need? Mysterious reports about North Korea's Kim Jong-un's health. He hasn't been seen in public for weeks. Good evening, everyone, and thanks so much for streaming with us. I'm Lindsay Davis. Let's start off tonight with some context for all the COVID-19 stats and numbers. There are more than 3 million cases globally, and by the end of tonight, it's very possible the number of confirmed cases here in the U.S. could reach 1 million. That's 1/3 of the known cases worldwide right here. But on both coasts and in between, we see many Americans trying to return to some sense of normalcy. From the beaches of California to Florida, police are monitoring social distancing. A hopeful moment, though, here in New York, where the last patient from the U.S. Navy's comfort ship disembarked as the need for hospital overflow has decreased in recent days. But we begin tonight with a hot topic right now, antibody testing. Doctors say it could help us turn the corner in the fight against the coronavirus, providing potentially life-saving treatments for COVID-19 patients. Our Kaylee Hartung leads us off.
Tonight, states laser focused on testing, expanding screening for COVID antibodies. New York has run 7,500, nearly 15% testing positive. 5,000 more on the front lines will be tested, including emergency workers and police.
NYPD was out there every day, and they paid a terrible toll.
In Miami, researchers estimate 165,000 have antibodies indicating prior infection, dwarfing the entire state's known cases of roughly 30,000. But accuracy is an issue. A new study of 14 coronavirus antibody tests found only 3 delivered consistently reliable results.
I worry a lot that people are going to draw conclusions from some of these tests that may not be accurate.
The WHO warns even if you have antibodies, there's still no conclusive evidence of immunity.
I think what WHO was saying, we don't know how long that effective antibody lasts. And then I think that is a question that we have to explore.
While it's unknown whether there's immunity to COVID, with SARS it's estimated to be 24 months. In the common cold and flu, just 6. But people with antibodies may be key to treating the most critically ill. That's why I donated plasma after recovering.
I just can't believe that I have the ability to do something that could be so helpful.
Each donation can help up to 4 patients fight the virus. Just 2.5 weeks ago, Jimmy Hayden was in a coma and given a dose of experimental plasma.
In my heart, I believe that, the plasma did it, and it made all the difference.
Today, back at home with his wife and 4 kids, meeting the man they credit with saving Jimmy's life.
And David, I can't even put all the words together to say thank you.
All I want to say is that I was happy to do it, and I'm glad you're well.
You just know that you are our hero.
Heroes abound at this time, and Kaylee Hartung joins us now. One of those heroes, of course, Kaylee, you have firsthand reporting on this, having donated yourself. So tell us more about that process of donating plasma.
Lindsay, you and I talked about how I was frustrated during that process, trying to figure out how to donate. It turns out all I really needed was a dose of patience. You need to be symptom-free for 28 days before you can donate plasma. The Red Cross called me just 2 days after I became symptom-free, hitting that benchmark. I, of course, had filled out the online form to request to donate much before that. But once I got to the Red Cross blood bank, I was so pleasantly surprised at how streamlined the process was. I filled out some paperwork. I had to do a simple health screening that you need to do before any blood donation. And then I was in that recliner for less than an hour. Now, there are 4 rounds of your blood being taken from your body, the plasma separated, and then your blood put back in. You feel pressure right around your arm here from a cuff as your blood is being taken out. You squeeze a little sponge to help the process along. And then when your blood is being returned to you, you feel a cooling sensation. I felt like it was pain-free. I spoke with David, who you just saw, the donor to Jimmy, and that piece there. We shared that sentiment. I really don't think there is anyone for there is anything for anyone out there who is capable of donating to be afraid of. If you were thinking of donating, you can go to the Red Cross website. You can fill out that same donor form I did, and you can be in and out of the door of one of these donation facilities in less than 2 hours.
All right, so pain-free for potentially life-saving and preserving results for somebody else. I know that initially the rules said basically that you had to have had an official COVID positive test in order to be able to donate. Have they relaxed that at all? Because a lot of people say, hey, I know I had it. I couldn't get access to a test. I didn't need a test to know that I had the symptoms of actually having it.
Right, we're hearing that a lot, Lindsay. And in my case, I needed proof of that positive COVID test and then needed to wait 28 days symptom-free. But you're right, we are seeing those regulations change. The Red Cross now is using antibody tests to test those presumptive positive cases, which means this donor pool is going to expand tremendously. That community blood bank in San Antonio you just saw, they're doing that as well. Again, anyone who thinks that they could be a qualified donor, I encourage you to reach out to your local blood bank or the Red Cross and see what you can do to help. Lindsay, I just learned today that my plasma has been processed and is helping 3 people in urgent need.
Oh, wow. That's great news, Kaylee. Thank you. Thank you so much for sharing that. We turn now to our country's great experiment, if you will, how and when to begin reopening. Today, more heartache in some persisting hotspots, but signs of hope in others. Tom Yamas now on when Americans can expect to return to some semblance of normalcy and if it's safe.
As restaurants in Georgia open for business and talk in Washington turns to reopening, at the epicenter of the coronavirus outbreak, the battle is far from over.
Number of new cases, still 1,000 new COVID cases every day. Puts it in perspective.
In Manhattan, Ruth Caballero of the Visiting Nurse Service boards a city bus, heading to the new front line of this fight.
I'm the nurse that spoke to you this morning. We're outside.
She suits up, gown, mask, gloves.
I'm now going to see a COVID positive patient that was discharged from the hospital yesterday.
For the patient she sees, leaving the hospital is just the first step.
They're weak, and emotionally they are afraid. They're afraid that they're going to die. They're afraid that they sent them home to die.
In the hospitals they leave behind, the work never stops, taking a profound toll on the doctors and nurses witnessing so much pain. Tonight, the New York Times reporting the medical director of the emergency department at New York Presbyterian Allen Hospital, Dr. Lorna Breen, dying by suicide. Dr. Breen had contracted the virus herself, recovered, and gone back to work. Her father telling the Times, make sure she's praised as a hero, because she was. Tonight, anguish from her friend, Dr. Debbie Yee Maddock.
I originally felt sad, and now I just feel devastated. With all these people who are asking for lockdown to end, what about us? We didn't sign up for this.
And in New York today, Governor Andrew Cuomo urging residents to stay at home so any gains aren't lost.
May 15th is when the pause regulations expire statewide. I will extend them in many parts of the state.
In other parts of the country, the virus still raging. Massachusetts now seeing its surge plateau. The governor announcing nearly 2,900 people have died, a staggering 56% of them in nursing homes.
The numbers are tough to comprehend, but they illustrate the lethal grip COVID-19 can have on seniors.
But in one hard-hit state, a reason to cheer. For the first time in 36 days, no one in New Orleans died of COVID-19. Parts of the South now planning to reopen. Restaurants in Tennessee and Georgia started welcoming customers today. Stephen Leslie's restaurant, Roasters, has been open for 30 years. Today, supplies rolling into the kitchen.
I'm kind of excited because these are my family. I get emotional. But, you know, these guys need work. They need to make money.
Texas restaurants, museums, libraries, and malls now allowed to open their doors on Friday at 25% capacity. In Ohio, manufacturing and construction can resume next week. Some offices can open, too, with reduced staff, masks, and health checks.
I think we've found the sweet spot, but it's a risk.
Health officials warn Americans should still practice social distancing. But over the weekend, crowds flocked to California's beaches.
This virus doesn't go home. because it's a beautiful sunny day around our coasts.
But today, President Trump sending a different message on a call with governors, urging them to seriously consider reopening the nation's schools. And as states reopen, the president is under pressure to step up testing. Today, he brought business leaders to the White House.
The testing that's been developed and being developed right now has been truly an amazing thing.
We now bring in Tom Yamas. And Tom, there seems to be some mixed messages from the president on how and when the state should reopen. What's the latest?
Yeah, you hear from people like Dr. Birx, who's one of the nation's top health experts, who's advising the president, and she's talking about having social distancing in place well into the summer. But then you hear from the president in his tweets talking about liberating some states. And today in a call with governors, he was talking about several states reopening, and he went even further than that. So at times they do seem to be on two separate pages. It could be the president came to the White House as a businessman, and now he has to listen to some of the top scientists in the country right now who are still warning we are far from over when it comes to this pandemic.
And the president talked about schools making some headlines tonight. What did he have to say?
Yeah, he made some big headlines, Lindsay. The president acknowledged the school year is almost over, but he said several schools could open for a short period of time, though he didn't really give any examples or say where this was going to happen. He also said young people tend to do better with the virus, and he is right in that regard. But anyone with kids, and Lindsay, you know this, knows that when little kids get sick, they spread those viruses like wildfire. I spoke to a doctor early on in this pandemic, and he said the big fear with children and COVID-19 is not them getting sick. It's them getting sick and then coming home and spreading that to their parents and to their grandparents. Lindsay?
Of course. All right. Tom Yamas, thanks so much for that. We want to go back now to that sad news from the front lines that you heard just a few moments ago. Dr. Lorna Breen, a top emergency room doctor in New York City, treating COVID-19 patients who died of suicide. Let's bring in Dr. Jen Ashton now to talk about this toll that this pandemic is taking on our doctors, nurses, and hospital workers. Thanks for joining us, Jen. I want to just get right into the idea that, we've heard, of course, about these stories from the front lines anecdotally, doctors and nurses seeing so much death, working long and taxing days amid so many unknowns. But what's the real emotional strain and toll on them?
Lindsay, it's really so difficult to describe, and it's not just, as you said, hospital workers, but it's first responders. This is, in a lot of ways, very similar to what members of the military see when they're in battle. You have to remember that we go into medicine and healthcare to try to heal people, to take care of people, to save lives. So when you're confronted with this much sickness and death in such a short period of time, it is not only physically taxing, but it is incredibly emotionally taxing as well.
And what kind of resources are typically provided to those who are working on the front line? And do they even have time to utilize them during a situation like this?
Well, there are crisis managers and mental health professionals, social workers, definitely available to healthcare workers, doctors, nurses, first responders, definitely in times of crisis, natural disaster, mass shootings, things like that. The hard part, Lindsay, is that there is a real barrier, especially in the field of medicine, to asking for help. And we have got to change that because we really have to walk the walk and talk the talk and practice what we preach. And so asking for help is not a sign of weakness, it's a sign of strength. And that can be really hard to do in times like this.
And Jen, of course, it's not just the emotional stress and physical stress affecting healthcare workers and others, but we're also learning now more about other more potentially serious consequences of COVID-19 that affect the central nervous system, including, of course, we talked about headache, dizziness, seizures, but strokes, loss of smell and taste, all neurological manifestations, but also the psychological consequences like cognitive impairment, depression, anxiety, in some cases leading to suicidal thoughts or suicide. So is it really important that we make sure that we not overlook the mind aspect in addition to the body?
Well, so many important things to unpack there, Lindsay. First of all, we have to remember this virus is still not even 5 months old, right? So even though it started as a primary respiratory pathogen, we are seeing now, not just here in the U.S., but from clinical case reports from other parts of the world, that this virus does not discriminate. It literally can attack almost any organ system, and in fact does. Sometimes someone can survive a respiratory illness and then succumb to a psychiatric illness, and we desperately want to avoid that now more than ever.
All right, that check up from the neck up, so essential. And Jen, thank you so much for just your steady hand and your knowledge through all of this. We appreciate it. I want to let our viewers know, if you're struggling with thoughts of suicide or worried about a friend or a loved one, help is available. Call the National Suicide Prevention Lifeline at 1-800-273-8255. That's 1-800-273-TALK for free, confidential, emotional support 24 hours a day, 7 days a week. Even if it feels like it, you are not alone. And now let's dive into how the country will move forward with former New Jersey governor and ABC News contributor Christie. He wrote an op-ed in the Washington Post this weekend on the 5 actions we need to take to restore the American way of life. Governor Christie, thanks so much for joining us.
My pleasure, Lindsay.
So you write that we all have to take responsibility and move forward in the face of fear, and you offer several suggestions. So let's go through them. First, you argue that the president should expand the use of the Defense Production Act to get the supplies needed for widespread testing to the states. Several governors have been asking for this. So explain what this would accomplish, and why do you think that the president hasn't done this already?
Well, what it would do is what it's done in the area of ventilators and personal protective equipment, which is to direct those folks to do things in a certain way and to direct all of that product to FEMA for them to be able to distribute as needed to all the states rather than having the states compete with each other. Governor Hogan did a great job getting 500,000 test kits from South Korea, but we shouldn't have governors doing that. We should have the federal government taking control of those productions and directing where it goes, because it should go where it's needed, not who's going to pay the most or who makes the first phone call.
Now, you say that employers and public venues should have temperature checks, but does that work if nearly a quarter of those with the virus are actually asymptomatic?
It's not going to be perfect, Lindsay, but what's happening right now in our country is people are losing their jobs. They're losing their ability to put food on the table for their families. I drove through Morristown and saw a line at the food bank that went halfway down the street in my county seat. I mean, so we have to understand that until there's a vaccine, we're going to have to live with some measure of risk and take mitigation steps like temperature checks, like everyone wearing masks when you're outside. There's a number of things we can do to mitigate it. It's not going to be perfectly safe, but you know, there comes a time where we have to decide, can we save this country's way of life? And that's why I wrote the column I wrote this Sunday.
Earlier today, President Trump tweeted, "Why should the people and taxpayers of America be bailing out poorly run states like Illinois, as example, and cities in all cases Democrat-run and managed when most of the other states are not looking for bailout help?" Now, Governor Cuomo responded by noting that his state pays more than its fair share in federal taxes, and they'll need extra help as they've been hit the hardest. So should the federal government be helping states and cities whose finances are being devastated right now?
Well, I'm empathetic to Governor Cuomo's position because as the governor of New Jersey, we got the worst return on the federal dollar of any of the 50 states. And New York was second to last. But that's not the point. We shouldn't bail out. I agree with the president. We shouldn't bail out poorly run states. We should only compensate those states for the losses that they've suffered because of the virus. If they had budget problems beforehand, they're going to have to deal with those problems. But they'll be able to quantify the revenue that they've lost based off of last year's revenue and the change to this year because of the virus. That's what we should help states in doing. We shouldn't bail them out for old problems, but we should support them because the COVID crisis, as the president has said many times, is not anyone's fault. And it's certainly not the fault of any of the governors in these states. And we need these state governments to continue to operate, to do the testing, and to provide all the services that state government provides.
And more broadly, you've seen the president lash out at governors during this pandemic. Is that an effective way to govern during a crisis? And should the president be doing more to bring the country together?
Well, I think there are times that the president's done much to bring the country together, and other times when he's gotten into fights with governors for no reason. The same rules apply to the governors, though, too. They shouldn't be fighting with the president at this time either publicly. everyone's talking to each other on a regular basis. You should hash out those differences if you can in private, because what the country needs is to see their leaders all working together to get things done. So there's plenty of blame to go around here, and tomorrow's a new day. So let's start tomorrow with making sure that everybody works with each other, gets along with each other. Doesn't mean we won't disagree on things, but let's not be attacking each other, because that's not going to help to solve the problem we're in right now, Lindsay.
And you list the 5 main priorities. Where does testing fall in that? Is that paramount in all of this as far as us getting back on the right track?
It's very important, but it's not the be-all and end-all, Lindsay. It's important for us to be able to test, but if we wait until we can test every American to be able to reopen our economy, we won't have an economy left. And that's a simple fact of what's going on in our country right now. People are growing frustrated. You have states that won't give any timelines to people as to when they're going to be able to leave their homes. You have states right now who have closed parks and golf courses. People can't leave their home to go for a walk. This isn't what we need to do now. Now, we've been shut down now for about 5 weeks. The American people need a timeline from their governors as to when they're going to do this. Now, people complained when the president said he wanted to do it, so he did what I think the Constitution requires, which is to let the governors do it. But now every governor has an obligation to start telling people when they're going to get their some semblance of their lives back, especially when they're going to get to go back to work, when are their children going to go back to school.
Governor Christie, thank you so much for your time and your insight. We appreciate it.
Lindsay, thank you very much.
And when we come back, rumors continue to swirl about the health of North Korean dictator Kim Jong-un. We separate fact from fiction. Plus, the new steps airlines are taking to change the way we fly because of this crisis. They could come sooner than you think. And the feel-good news we also desperately need, including this emotional moment. A volunteer nurse and her journey with one patient finally on the road to recovery. But first, here are some of the trending headlines on abcnews.com.
Good morning. I'm sorry I've been away from my desk for much longer than I would have liked, and I want to thank everybody who has stepped up, in particular the First Secretary of State, Dominic Raab, who's done a terrific job. But once again, I want to thank you, the people of this country, for the sheer grit and guts you've shown and are continuing to show.
That is UK Prime Minister Boris Johnson in his first address outside Downing Street since contracting COVID-19 a month ago. Johnson spent, you'll remember, 3 days in an intensive care unit at a London hospital earlier this month. But today he was back at it, back at work, urging people to continue to adhere to lockdown measures as the UK turns the tide. Next, the mysterious absence of North Korea's Kim Jong-un. The dictator has been out of view for more than 2 weeks at this point, sparking rumors that he's sick or even may have passed away. ABC's chief global affairs correspondent Martha Raddatz joins us now. Martha, what do we know about his whereabouts?
Well, you know, Lindsay, President Trump was just asked about this, and he said he knows, relatively speaking. He said, I just can't tell you exactly. I do have a good idea, but can't talk about it. Meanwhile, a senior U.S. defense official tells me that reports that he is dead or gravely ill are, as the source said, hogwash. But there is this satellite image, a kind of fascinating satellite image from Planet Labs 38 North that shows a long train outside of one of Kim's compounds. We all know he's been on those trains many times, that luxury train that took him to Vietnam. But at this point, we really don't have any more information. There is clearly something going on. He's out of view. But back in 2014, he also disappeared for about 6 weeks, turned up with a cane and said he had ankle surgery. So we don't know exactly. It could have something to do with COVID-19, although North Korea says they have had no cases. But, Lindsay, that is impossible to believe.
All right, we will stand by for news. Martha Raddatz, our thanks to you.
You bet.
And coming up next, we shine a light on the hidden victims of this pandemic, people delaying hospital visits for serious health issues unrelated to COVID-19. The results can be disastrous. Plus, as states start to reopen, many hope for a quick recovery for a battered job market and struggling economy. What experts say about where we could be headed. And our tweet of the day, a very happy birthday from Arnold Schwarzenegger.
Happy birthday to you. Happy birthday, dear Lulu. Happy birthday to you. Look at this. Huh? Are we not celebrating birthday really great, huh? Sorry, the candles are unnecessary here. Oh, yeah. Oh, here's another one. Oh, yeah. Here's another one, a crumb. Oh, yeah. Oh, yeah. And there we have it.
We turn now to jobs. Even as some states start to cautiously reopen for business, so many Americans are concerned about their jobs right now. And on the other side of this crisis, most economists predict we'll see the worst unemployment since the Great Depression. So let's take a look at some of these predictions by the numbers. The latest official U.S. unemployment rate is 4.4%. That's for March from the Department of Labor, but that does not capture the 26 million Americans who recently filed for unemployment benefits. They'll start to be counted in next month's report. The nonpartisan Congressional Budget Office predicts U.S. unemployment will reach 14% in the coming months and peak at 16% early fall. Another organization, the IMF, predicts U.S. unemployment will reach 10.4% this year. The investment bank Goldman Sachs forecasts unemployment rising to 15% later this year. To put these predictions in perspective, unemployment rose to 10% during the 2008 recession and peaked at 25% during the 1930s Great Depression, when high unemployment lasted about 10 years. Coming up, the changes colleges and universities are looking at in the wake of this pandemic, what it will take to get students back on campus this fall. Plus, a startling image, a flight almost completely full in the middle of the lockdown. A closer look at what air travel could look like going forward, starting with the way you sit. We'll explain in just a moment.
States are joining together to reopen their economies in a phased manner. In the South, Kentucky and Tennessee are rolling out the first phases of reopening this week. Tennessee Governor Bill Lee is allowing most of the state to reopen restaurants for dine-in service. That despite the big one-day spike in COVID cases on Sunday. This follows similar action in Oklahoma, Georgia, and Texas.
Well, because of your efforts, the COVID-19 infection rate has been on the decline over the past 17 days.
Minnesota is also trying to ease restrictions, but the green light to reopen doesn't do away with everyone's fears.
I'm not willing to sacrifice restaurant workers or elderly, my staff, or my customers to make money in the short term, and I think that should be our priority.
Several states say it's still far too soon. Today, New Jersey Governor Phil Murphy laid out the state's strategy to reopen, but says right now he can't give a start date for when that plan would begin.
Before we reopen non-essential stores and businesses, before we can reopen our parks, people need to know, first and foremost, that their health, that your health will be safeguarded from COVID-19.
In California, Governor Gavin Newsom telling residents who crowded beaches this weekend they are hurting the state's chances of reopening sooner. 45 more deaths in the state in the past 24 hours.
The images are an example of what not to see. People, what not to do if we're going to make the meaningful progress that we've made in the last few weeks extend into the next number of weeks.
In New York, cases continue to go down.
May 15th is when the pause regulations expire statewide. I will extend them in many parts of the state.
Italy's prime minister announcing a gradual plan to relax their lockdown beginning May 4th. Parks will reopen for exercise, although no gatherings are allowed. Most businesses can resume work, and people will be allowed to visit relatives as long as they're wearing face masks. Spain, which has seen the most cases in Europe, is relaxing its restrictions for children under 14 so that they can play outside for 1 hour a day with an adult companion. In Germany, Volkswagen is reopening its biggest factory with 8,000 employees returning to the production lines. In France, work began on the fire-damaged Notre Dame Cathedral. Meantime, UK Prime Minister Boris Johnson is concerned that lifting the lockdown too soon could lead to a second spike.
I refuse to throw away all the effort and the sacrifice of the British people and to risk a second major outbreak and huge loss of life.
Speaking on his first day back since contracting COVID-19 3 weeks ago, Johnson said the UK was beginning to turn the tide, but restrictions are in place until at least May 7th.
Researchers are ramping up testing on a medication usually used to treat heartburn.
Over the past few weeks, researchers have been discreetly studying whether famotidine, the active ingredient in Pepcid, could be used to treat coronavirus.
Not using conventional, what we call Pepcid or over-the-counter reflux doses. We're using much larger doses.
The basic theory, the drug may slow down the virus and keep it from spreading within the body.
Welcome back. As hospitals around the country work around the clock to treat COVID-19 patients, there is an unintended consequence here. The American College of Emergency Room Physicians says that non-coronavirus-related ER visits dropped 40% around the country last month, as many Americans seem to try to avoid visiting hospitals during this pandemic. And as Will Carr reports, the consequences of ignoring serious health issues and delaying treatments can be devastating.
Across the country, while emergency rooms have morphed into the front lines in the war against COVID-19, many with non-coronavirus emergencies are staying home.
As I had envisioned kind of a chaos, and I thought, oh, gosh, you know, they don't need me in there, and I really don't want to be there.
Andrea Gleason started to have chest pain.
Right in the center of my chest was like a squeezing pressure, very painful. And the more it happened, the more painful it got.
But because of the crisis, she waited for a week before the pressure got so bad she had to go to the hospital.
The blockage is right there.
Turns out she had an artery that was 90% blocked. Dr. Andrew Dublin with John Muir Health put in her stent.
What would have happened if she decided not to go to the hospital?
The odds were not in her favor, so there was a real good chance that she was going to have a big heart attack that either she could have died from or would have forced her to come in a lot worse shape.
It may be that as many as 30 to 50% of heart attacks are not being seen right now. Similar numbers for stroke, and clearly that's problematic because that means people aren't getting the care they need.
The American Heart Association says if you have an emergency, you need to act now just like you would before COVID-19.
If you are somebody who is at risk of things like heart attack, you have hypertension, you're a smoker, you're an older individual, you've had diabetes, you should really think about seeking emergency medical care for things like chest pain, shortness of breath, dizziness that's not remitting over a short period of time.
As parts of the country are flattening the curve, some emergency rooms are now seeing far less traffic than before the crisis started. That's in part due to a drop in car accidents with fewer drivers on the road. That might sound like a good thing, but fewer car accidents also means fewer organ donations.
There are people that will die because we don't have donors, and that's an unfortunate reality.
At Vanderbilt University Medical Center, Dr. Seth Karp has seen a 30% drop in transplants.
If I say that our volumes are down by 30%, it means that had the COVID epidemic not have happened, that we would have done 30% more transplants and we would have saved 30% more lives.
One organ donor from a car accident can often save multiple patients in need of a transplant. But now many surgeries, especially for patients who are stable, are on hold due to the virus.
Are you in pain right now?
Yeah, I'm in pain just about every day.
In Kentucky, Phyllis Blake has liver cancer. Her transplant was postponed indefinitely when COVID-19 struck.
Well, I was upset.
Adding to her emotional stress, Blake already has a donor, her granddaughter, Katie.
What's your biggest concern?
My biggest concern is that the cancer will spread while she's waiting, and then she won't be able to do the transplant.
Overall, surgeries, including transplants, have dropped across the country. Economically, fewer surgeries means less long-term money for many hospitals that were already running on tight budgets before the crisis.
So some hospitals are going to go bankrupt, and the ones that are most at risk are not the ones in the nice suburbs. They're the ones in rural America. They're the ones that were already struggling financially.
And Will Carr joins us now live. Will, of course, it's troubling to hear that people may be ignoring signs of a potential heart attack. Are doctors saying that they're also seeing visits or treatments for other serious health issues being delayed during this pandemic?
Absolutely, Lindsay. According to the American Cancer Society, 1 in 4 Americans who has cancer has seen a delay in their care. And think about all the physicals that people schedule that have either been canceled or pushed back. That is happening all across the country. And those physicals could be exams where you find an issue you don't even know about that could potentially save your life. Lindsay.
Right. And we also heard in your piece from Phyllis, who needs that liver transplant. Have you gotten an update in her case?
We have, and we have good news tonight. We found out that Vanderbilt University's Medical Center, where Phyllis is going to get her treatment, just relaunched their liver transplant program this week, and everybody's hoping that Phyllis can get scheduled soon. Lindsay.
All right, we got to celebrate those victories. All right, Will Carr, thanks so much for that. As we've been reporting, COVID-19 has led to a crisis in the way that we eat in this country. Thousands of people are now being forced to wait in line for hours to get food that they no longer can afford on their own. At the same time, farmers are being forced to throw away perfectly good food, unable to get it to those who need it most. ABC's Steve Osinsami has a closer look now at this disconnect and the innovative ways that people are trying to fix this problem.
These are the lines across the country, thousands waiting for food that they can no longer afford to buy on their own. And this was the governor of New York today, talking about dairy farmers upstate overflowing with product that they can no longer sell.
We have people downstate who need food. We have farmers upstate who can't sell their product. We have to put those two things together.
One of the country's largest meat providers has taken out this ad in large newspapers explaining that the food supply chain in America is breaking and predicting limited product and higher prices for their meats. COVID-19 has forced 13 of the country's largest meat plants to close tonight. And the chairman of Tyson Foods says that protecting workers means that millions of pounds of meat will no longer be shipped to grocery stores. He says there is a serious food waste issue and that these same producers could have fed the nation. We first told this story here in a report that has now inspired a movement.
We watched your program last Tuesday, April 14th, and it started with the idea that we need to do something about this.
Hundreds of volunteers are raising money to buy food from farmers.
We're able to buy food from farmers and simultaneously feed the people in the South Bronx that need that food.
This tonight is the fruit of their labor. More than 43,000 pounds of potatoes trucked across the country from a farmer in Idaho.
And Steve Osinsami joins us now live with more. Steve, there appears that there's plenty of food available. So what's the problem here?
Well, the problem is moving it. It's picking it. It's getting the food from the farm to the table. You know, we're learning how difficult that is and how much effort is involved. And it's hard to get that done in the middle of the pandemic.
And Steve, you've been following Georgia's gradual reopening. How are things going, or is it still too early to tell?
Well, I think it's a tale of two stories, so to speak. On one hand, you have businesses, hair salons in particular, that are open, barber shops that are open, and many of these business owners tell us they're booked solid for 3 weeks. And then you've got a number of restaurant groups that aren't open, and a lot of people who are happy that those businesses that are open. So it's too early to tell right now if the governor's efforts here are successful. What everyone is hoping is that the businesses stay open, but also the number of infections and hospitalizations stays low.
Of course.
Lindsay.
All right, Steve Osinsami, thanks so much for that report. And we turn now to the nation's skies, which have seen a dramatic drop-off in passenger travel since this pandemic began. But images from a near-full flight this weekend, they're raising some concerns over whether proper safety and social distancing measures are in place on planes as states begin to open up and travel starts to increase. ABC's Gio Benitez has this story.
Tonight, 6 seconds of video getting a lot of attention online. A passenger on an American Airlines flight Saturday from New York to Charlotte, nearly full, people sitting side by side, some wearing masks. Aaron Strine recorded the video.
What was this experience like? Because you get on this plane and you were surprised to see so many people.
It was shocking, to say the least, and it was the first time that I felt truly unsafe. I recognized the risk that I was taking by agreeing to be on an airplane in the first place, and while I wanted to believe all of the, precautions would be taken that I had read on the airline's websites, there are lots of asterisks there.
The plane was about 85% full. The airline says it's leaving about half of its middle seats in standard economy empty.
This flight in particular was not a leisure flight for you.
No. So my grandmother passed away recently. And so I wanted to come home to be here for my parents, my dad especially. It wasn't a decision I made lightly. The least that an airline can do right now is require their passengers to wear masks.
American announcing tonight it will start to distribute masks to passengers. And this week, other airlines intend to make changes too. United telling ABC News that flights should look like this, with one seat empty next to every passenger. Still, United says it can't guarantee it. But if so few people are traveling to begin with, why does this all matter? Well, it turns out last week we saw an increase in travelers, the first since the pandemic began. The TSA reporting nearly 770,000 passengers screened, about 85,000 more people than the week before. Then there's the issue with the masks. Not all passengers are wearing them. Sarah Nelson heads up the largest flight attendants union in the country and wants all passengers and crew wearing masks.
From the airport door to the airplane door, on the airplane, and then back out through the airport at the other end, we want people wearing face coverings in all those areas. That is what is recommended by the CDC to the general public when they are out in public. And that is exactly what should be happening in our airports and on our airplanes to help contain the spread of the virus.
And that's not all. Nelson says the union wants the federal government to suspend all leisure travel. While all major U.S. airlines say crew members can wear masks, United and JetBlue have required masks since last week, and tonight, American announcing it will do the same for its flight attendants starting May 1st. Most of the airlines are either providing personal protective equipment or working to provide it. The CDC telling ABC News all passengers should consider wearing face coverings while traveling. American Airlines also telling us tonight it will provide masks and sanitizing wipes or gels to customers beginning in May. Gio Benitez for ABC News Live in New York.
Our thanks to Gio for that report. Graduating seniors have just 4 more days to decide where or if they're going to college. Faced with the prospect of distance learning, nearly 1 in 6 seniors now say that they're considering taking a gap year, according to a poll by the Art and Science Group. Harvard announced today it will be back open for fall 2020 with the goal of being on campus, quote, as quickly as possible. Meanwhile, students at Michigan State have now filed a lawsuit against the university demanding refunds for tuition, room and board. As Eva Pilgrim reports, coronavirus is making the future of higher education complicated.
As coronavirus forces students to finish the school year at home, some universities are working on a possible plan to hold classes on campus next fall.
We would love to have a senior year, but we do worry about what health risks that would pose not only to older people in the community, but to other students like us as well.
Indiana's Purdue University making plans to try to bring its community of more than 50,000 students and staff back to campus this August. President Mitch Daniels writing in a school-wide email that COVID-19 poses close to zero lethal threat to students, saying instead our students pose a far greater danger to others than the virus poses to them, and vowing to find a way to keep vulnerable groups separate and safe.
While I'm not personally at risk, it did seem that they were discounting the potential issues that students who are at risk or who may live with immunocompromised family members.
Roommates Kaylee Boomansour and Jalen Kelly still concerned about young people who have pre-existing conditions, like Jalen, who struggles with asthma.
My fear would be that given the language used in the email, students wouldn't realize how serious of a situation we're dealing with.
Daniels laying out some preliminary practices that would allow the university to reopen, spreading out classes and reducing sizes, pre-testing students and staff for the virus, and using contact tracing and self-quarantining. Brown University's president, Christina Paxson, also on board, writing in the New York Times, the reopening of college and university campuses in the fall should be a national priority. Institutions should develop public health plans now that build on 3 basic elements of controlling the spread of infection: test, trace, and separate. All this as the May 1st deadline, decision day for incoming students, is looming. Many now reconsidering their plans.
It's really unappealing to me, the idea of paying for college and doing all of that schoolwork when I'm not able to connect face to face with the people that are teaching me and the people that I'm working with.
Our thanks to Eva Pilgrim for that. And when we come back, the good news that we all so desperately need. This choir is made up entirely of healthcare workers. Their message about the importance of music in these challenging times. And our myth bust of the day: can hot weather stop the spread of COVID-19?
Right now, how do you make sense?
Welcome back on this Monday. Many of us are starting yet another week still at home, and so many facing tough times. That's why in the middle of all this, we want to share with you the moments that give us a bit of hope and a smile. ABC's James Longman has tonight's Feel Good News.
Hi guys, as you know, I've just got back from 2 countries where life seems a little bit more normal, and it's been really lovely to catch a glimpse of what our own lives might look like eventually. Right, first up tonight, is something actually that's happening here in the UK. It's called the 2.6 Challenge. It all started yesterday on what would have been the 40th London Marathon. And really the idea is people are fundraising for charities that have been hit hard by this pandemic. 2.6, 26, that's the number of miles in a marathon, of course. And people really can do anything, walk, run, juggle, just about anything to raise money. All kinds of people are getting involved, either doing the fundraising themselves or contributing to it. And even some celebrities are also getting involved. These are some of the videos that we've liked best. And weeks into quarantine, it's clear we're all trying to find ways to have fun however possible, including here in England. These seniors raiding kitchen cabinets for pots and pans in their balcony concert. More music now, slightly better though. A California-based music school founded by a member of the Red Hot Chili Peppers is spreading joy through music. 50 kids uniting and their rendition of David Bowie's Space Oddity. And another choir, but it's not just any choir. This one made up of health workers from an NHS hospital here in the UK. Their mission is clear: spreading love and positivity. We caught up with one of the singers, Nurse Eva DiMaddi, on the importance of song in these challenging times.
We have faced quite challenging times at work, and it's quite sad sometimes.
Trouble seem like it never ends.
So yeah, every time that I'm sad or every time that I have a bad day at work or I feel a little bit down, I'm just thinking about this amazing choir and start singing of one of our songs. I know that it's very hard for most of us. To be in quarantine, to not see our loved ones. But the only thing that we can do, and it's very important, is to just keep positive. Like, think positive, that we're going to get through it. It's just a storm, and after the storm, the sun is coming out.
Well said. The sun will come out eventually. Thanks to Eva and the Breathe Harmony Choir for inspiring us all. Finally, as always on Good News, we want to focus on the love pouring out for healthcare workers on the front line. In particular tonight, we want to focus on a selfless Rhode Island nurse. Meet Taylor Campbell. She volunteered to work for 21 days at a metropolitan hospital in hard-hit New York City. Taylor posted to Facebook about how on her last day, the first patient in her unit who'd been on a ventilator the entire time got taken off that ventilator and is now on the road to recovery. We talked to her about what this beautiful moment meant to her.
You know, for 15 days, she was my family, and I feel like I was her family. We took the tube out, and they put the BiPAP machine on her. So it's, you know, this mask that covers your nose and your mouth, but you can still see her lips. And she looked right at me and said, "I love you." I asked her if she had heard of me talking to her for the last 15 days, and she said yes. I asked her if I was annoying over the last 15 days, and she said no. And I spent a lot of time in the room with her, holding her hand, and I sat on the bed, and we didn't really, you know, talk. She couldn't talk, but she just really wanted her hand to be held. And I just want people to know whose family members are on vents or in the hospital right now, and the family isn't able to go and visit them, is that we're taking really good care of them. And we're treating them like they are our family. Yeah. So I think that that's important, because there's a lot of people that are alone, but they're not alone. We're there for them. And I said, you know, she didn't have human contact for 15 days, and I was the one that was holding her hand and giving that to her, but she was also giving that to me because I didn't have human contact. There wasn't anyone that I could hug, or that someone could hold my hand or give me a high five. And, you know, we were there, her and I were there for each other.
And over the weekend, Taylor finished up her 21-day shift, and her family gave her the hero's welcome she really deserved.
Back to home, Taylor! Woo! Oh my God!
Well, that's all from us tonight. Stay safe, everyone, and be good to each other.
Thank you so much for that, James. And before we go tonight, the image of the day, and it's a very special one, near and dear to our hearts. Our ABC News Live family just got a little bit bigger and cuter, I might add. Take a look at this. That's our executive producer, Seni Tianabeso, with his new baby boy, Luke. A big congratulations to Seni, Rosemary, and big brother Jed. Everyone here is sending you lots of love tonight, and hopefully you're getting some sleep. That is our show for this hour. Be sure to stay tuned to ABC News Live for more context and analysis of the day's top stories. I'm Lindsay Davis. Thanks so much for streaming with us, and have a good night.
What you need to know right now. Confirmed cases of coronavirus around the world zero in on the 3 million mark. The frontline fight on the Las Vegas Strip. The county commissioner going head-to-head with the mayor over reopening. And the new routine ahead when it comes to daycare practices across the nation. The CEO of Bright Horizons is here. Plus, masking it. The